People themselves now wish to be more involved in their healthcare. Older people in particular welcome the opportunity to have a view as to what it is they would like to have done for them at a future date in the event of their having no longer the capacity to give consent or otherwise to the intervention.
Let Me Decide is an advanced care directive that has been developed by medical professionals over many years of research. The directive is designed to be accessible to all while being grounded in medical expertise. The medical journal Age and Aging describes how Let Me Decide gives clear and explicit instructions on how to make an advanced directive about one's healthcare. Everything is explained, everything is defined, and there is practical advice on how to make one's views unequivocally clear. Let Me Decide is an advanced care directive accessible to everyone. The directive exists as a book and an easy-to-follow form that can be used by adults of all ages. It uses medical terms with clear and definitive meanings. The steps are clearly laid out as to how to leave clear, succinct instructions about your preferences for the healthcare that you wish to receive in the event of you not being able to communicate for yourself. The form is divided into two main sections: the healthcare chart and the personal statement. The healthcare chart outlines the levels of care that the subject would wish for in the event of a life-threatening illness, their preferences around feeding, and their preferences around CPR. To begin with, the individual completes this section on the basis of their current level of health. In other words, the individual might be asked, if you were to become ill today, what would you choose? Following this, the personal statement is then completed. This allows the individual to state the condition of health that they would find acceptable or unacceptable, and can be used to state personal care preferences in areas not covered specifically by the form. Finally, the healthcare chart is completed again. This time, the preferences stated are for a time in the future where the individual is living in a condition of health that they consider unacceptable, in keeping with and informed by what they have written in their personal statement. A life-threatening illness is any illness that can potentially cause death. For example, pneumonia. Although pneumonia can be fatal, most healthy people recover from it with appropriate treatment. However, for individuals who find themselves in a condition that they find unacceptable, the decision may be to let the disease run its course. Aggressive treatment may realistically only serve to prolong the dying process, rather than give any hope of real and acceptable recovery. There are 4 broad levels of care that an individual can select to be administered with in a situation where a life-threatening illness exists. At comfort or palliative care, tests and treatments are done, not to prolong life, but to maintain comfort with the aim of relieving pain. Limited care would include treatment for illnesses using antibiotics, blood tests, x-rays and oxygen, but would stop short of giving the patient emergency surgery that requires a general anaesthetic. Surgical care involves emergency surgery, as well as the use of a ventilator or kidney machine if necessary. However, the patient would not be transferred to intensive care unless required to keep the patient comfortable. At intensive care, everything a modern hospital has to offer would be used to maintain the patient's life. People with severe illnesses are often not able to feed themselves, and a decision must be made as to if and how they will be fed. Let Me Decide covers this area by giving the individual the option of 2 main levels of assisted feeding: basic feeding and tube feeding. Basic feeding involves giving the patient a regular diet of fluids and solids. Supplements and a modified diet consisting of blended, soft or thickened food would also be given. Tube feeding can be achieved using either nasogastric or gastrostomy tubes. Nasogastric tubes are soft plastic tubes passed through the nose into the stomach. Gastrostomy tubes are passed through the skin in the abdomen directly into the stomach. Cardiopulmonary resuscitation is an emergency procedure that attempts to restore breathing and heartbeat in a person whose heart, breathing or both have stopped. CPR almost always fails to revive chronically ill older adults whose heart has stopped after a long illness. The individual completing Let Me Decide needs to consider whether they would want CPR performed in this situation. Every person has a different level of what they would consider an acceptable or unacceptable condition of health. Consider your situation today. You may be of good health and fully independent. In the event of a life-threatening illness, the chances are that you would want every available measure to be taken to preserve your life, no matter how uncomfortable or invasive. Imagine, however, a situation where disease has left you bedridden and fully dependent on others for washing, dressing, and feeding. Would you still want every measure taken to preserve your life in the event of a life-threatening illness? Let Me Decide helps the individual clearly state what an acceptable condition of health looks like to them, taking the guesswork away from the individual's family or doctor. Once this question has been explored and detailed in the personal statement, the individual completing the form is then able to choose the level of care that they would desire to receive, depending on their condition.
Been involved in end-of-life care, terminal care, palliative care for 31 years as a consultant. But in my opinion, the Let Me Decide package is very, very good. It's as good as any I've seen.
I have an auntie who we had to send to a nursing home. She has dementia. And we were told, read this book. It's an easy read. It's a straightforward read. And I was handed Let Me Decide. The book was brilliant preparation for an incredibly difficult conversation.
It has made life easier in that when it comes to the time for our residents to depart, everybody knows what's going to happen, really. There is no panic. We're all reading off the same page.
I would recommend the Let Me Decide programme. It makes complete sense to me. My mother, who is far closer to my auntie and has been caring for her for years and years, was also reassured by everything that's in that book. I said to myself, I have to sign one of these things.